Good afternoon, everybody. I think post-lunch, all of you are assembled to listen to this online training program, which is being regularly organized by Rajiv Gandhi University of Health Sciences. I, as the Vice Chancellor of Rajiv Gandhi University of Health Sciences, have the honor of welcoming all of you to this online training program. And this is being organized by Telemedicine Society of India, Karnataka chapter. And today we have with us Professor Dr. Umashankar, who is Secretary-elect of the Telemedicine Society of India, and also he is the Principal of Padma Shri School of Public Health. And we also have Dr. Suresh Badamat, President-elect for Telemedicine Society of India, Karnataka chapter, and Dr. Sanjay Sharma, Secretary TSI, Karnataka. He is a podiatric surgeon. This will be a sequelae for such program for 3 days, right? We are organizing for 3 days and trying to cover up all aspects of telemedicine. You know that COVID-19 has been almost we are living with COVID in the last 60 days in Karnataka, and a lot has been done. We have learnt a lot. As you know that this is a very dynamic disease. It keeps changing its profile, and we are also learning a lot of things about COVID-19 on a day-to-day basis. So to keep ourselves updated and also to reach out to the rural mass, telemedicine has come as a very important boon. And Government of India and also Government of Karnataka have enacted government orders which very clearly mentions that telemedicine can be done legally now. So keeping that in mind, and also because of the closure of many clinics and nursing homes and hospitals, many places, it was essential that telemedicine was adopted. And now slowly the clinics are now being opened up. Many private colleges, private medical hospitals, corporate hospitals, and private clinics are now supposed to open up and start seeing patients. However, there may be a portion of patients who would still want to have a teleconsultation or even a what you call discussion through telemedicine. So that being the case, we need to equip ourselves, because though this was there earlier, it has come to the forefront now because of COVID-19 pandemic. It has become more essential that we fall back on technology, make best use of the technology available, and try to reach out to our patients. So there may be a segment of patients who would be still comfortable using these things. With keeping that in mind, Rajiv Gandhi University of Health Sciences, in association with Telemedicine Society of India, has organized this program. I welcome all the speakers and also thank them for sparing their time and being with us. In the next 3 days, we will be covering various issues. And I'm sure all of you would benefit from this online training program. I would like to remind you that if you have any doubts, any clarifications or any questions, you could mail it through the chat box that you have on your devices, and it will be addressed at the end of the lectures. We have 3 lectures. One is Introduction and Use of Telemedicine in Context of COVID-19. Then Telemedicine Practice Guidelines. And of course, Telemedicine Practice Guidelines 2020 will be covered by all the 3 speakers. And then end of that, the question and answer session would be there. This is the model of the program. And to just to give you information, this is the 57th program that we have organized in the last 60 days. That means almost one a day. And that is a commendable job. We welcome you for this program, and without much ado, I would like to hand over the mic to Dr. Umashankar, please.
Good afternoon. Word alla. Good afternoon, everyone. I thank Vice Chancellor for giving us an opportunity to share our views on telemedicine practice guidelines, and which is very necessary in today's date. Full screen, Madhu. See, all of us are facing the crisis now, the current dilemma in healthcare system worldwide, where we are trying to provide healthcare services to the patients in a very sustained way. But whoever is affected by COVID or who are not affected by COVID, like who are having acute or chronic conditions, while protecting the physician, nurses, other health personnel, it's very important that we protect the healthcare personnel to taking care for providing continuous care to the population. So one of the solution to do that without affecting their health is telemedicine. So globally, health systems are now resorting to telemedicine to provide care while patients are at their home, uh, where they don't have to travel. So there are a lot of studies which have proved that telemedicine has been best for these kind of situation. So there are some studies where in US they have captured that there has been a rapid expansion of video enabled visits of patients. So it has been almost more than 600% in emergency cases or 4,300% in
Ma,
non-urgent cases
you don't make patients
response to
again sit in
COVID-19.
all the chairs.
So with this onset of COVID-19, it has demonstrated that a sizable proportion of outpatient visits in various settings can be clinically managed effectively from a distance. Where there is increase in demand in healthcare surge, we can have a control which can be done by what we call it as forward triage, where patient with non-urgent condition can be triaged to telemedicine services without compromising on their health or quality of care. So telemedicine, what are those? Like for example, you can screen patients who are suspected of ILI or SARI or COVID patients also can be screened. Suppose there are patients who have come for in-person care, who are where you are screening, who have been screened positive or who have a high risk, can be isolated immediately to avoid the further contact with the patients and to the health worker. So telemedicine not only helps in hospital, but also for patients who are at home, they can directly connect to the doctors, their own physicians or their own specialists, they can connect to doctors and have a consultation. So now telemedicine helps in making healthcare services available during this lockdown. Many of the doctors have provided teleconsultation services during the lockdown. Many patients have accessed without going out of their house because we need healthcare, especially a lot of chronic condition patients. Or especially something like disasters, even in disasters or emergent situation, it can be used. We have also seen a lot of home quarantine people who are quarantined at home. They also had took access of services through telemedicine. And similarly, chronic disease who need continuous care, for example, diabetes, hypertension, or renal dialysis patients, all of them were given treatment through telemedicine and the consultation was happening. So this particular tool is helping to protect the patients, clinicians, and community from the exposure. Not only the OPD consultations, patients in ICU also can be monitored remotely using tele-ICU, where when necessary, the doctor or the provider can go to the bedside. So this can reduce their contact with the infected patients in ICU. And other advantages, if we have shortage of specialists, so one specialist can cater to multiple patients at a time. So this has demonstrated a utility that telemedicine is a very effective tool for social distancing in clinical settings. So that is why we have also seen Government of India and other state governments have recommended telemedicine and to start telemedicine, as our VC also told that most of them have started telemedicine. Not only government institutions, even private hospitals have started. And the government has provided some kind of relaxed restrictions and regulations in telemedicine. One such measure is where the Government of India has notified the telemedicine practice guidelines, which will be dealt in detail by Dr. Suresh. Next. Thank you. You can share.
Good to go? Yeah. Good afternoon. I would like to thank the Rajiv Gandhi University Vice Chancellor for giving us the opportunity to discuss about the telemedicine practice guidelines. Myself, Dr. Suresh, I am the head of Telemedicine Center at NIMANS. and also to discuss the legal issues in telemedicine. I have also done my PhD in law from National Law School, so I would be happy to discuss any legal issues with telemedicine. Before that, I would like to have one disclaimer. Although this is an academic presentation, if you would like to have a clear-cut legal opinion, please do take advocate opinion. But however, I'll do my best to give you the legal opinion. But at the same time, please do refer to the original document of telemedicine practice guideline, which is available on Ministry of Health and Family Welfare website, which is mentioned there. So this is the telemedicine practice guidelines, which has been released on 25th March 2020, but it was gazetted only hardly 3 days back. But however, if you look at that, it clearly says that this regulation has been backdated. It is being deemed to be effective from 24th March, but it was released, it was notified only 12th May, but it has been backdated. So no need to worry. This is a valid legal document. See, one of the other important is telemedicine. Karnataka was the pioneer in this. In 2001 only, the telemedicine trust was started in the government of India, government of Karnataka, and we were able to do a lot of things, but unfortunately did not take off. But we were able to reach Mars, but we never reached the rural population because of various reasons. Doctors were apprehensive about the legal issues, and many of the state medical councils came up with various notification telling that not to be used. But however, the COVID-19 should have not happened, but it's a challenge, but it's an opportunity for telemedicine. And this is a long-awaited guidelines, and it has been released now. And if you look at the telemedicine guidelines, it has been notified under the Appendix 5 of Indian Medical Council and under the Indian Medical Council Act of 1956. But the question arises is, we have National Medical Commission Act 2019. So how does the old act has been already appealed? So how can this guideline becomes valid? This is the question, because the old Indian Medical Council Act has been completely repealed. How this will be valid? But if you look at the National Medical Commission Act of 2019, Section 61, it clearly says until the rules and regulations have been formed under NMC, till then IMC, whatever the rules, regulations are there, will continue to hold good. That means because NMC did not form the rules, the old rules, regulations, whatever the notification is done, will be legally applicable and valid. And now the question is, does this guideline discusses comprehensively about the telemedicine setup in India? No, it doesn't discuss completely. It doesn't talk about the hardware and software issues, infrastructure, maintenance. It does not talk about the data management, where the data will be kept, how the standard interoperability of those issues has not been discussed. Digital technology has not been discussed. Basically, if I'm transmitting EEG data or ECG data, how it will be maintained and monitored has not been discussed. Research and these kinds of continuous education has not been discussed under telemedicine. And the most important thing is, outside the jurisdiction of India, if a patient is contacting us or you from Malaysia, can I provide a telemedicine? He is my old patient, but he is now in Malaysia. Can I provide a telemedicine consultation? This guideline do not talk about this. It says that it has been excluded. So these are the limitations with this telemedicine guideline has been notified. So who can provide telemedicine consultation? It's very clear. The registered medical practitioner under Indian Medical Register under IMC Act 1956, he will be allowed to provide telemedicine consultation. So what are the prerequisites? What are the things he should know before he enters into telemedicine consultation? Please do understand, all the doctors need to follow the same professional, ethical and legal standards which are applicable in-person consultation. Same thing is applicable in telemedicine consultation. At the same time, along with this, the doctor has to undergo online mandatory training course, which will be notified shortly. The Board of Governors had a discussion just 1 week back. Most probably Telemedicine Society of India and NIMANS may be involved in the training of all the doctors across India. Till the interim period, this guideline should be followed, and considering the COVID-19 situation, all of us can provide telemedicine, but within 3 years, we should undergo mandatory training. So what are the ethical and legal standards for telemedicine consultation? The same professional ethics, legal standards, clinical standards which are applicable as in person is applicable in telemedicine. So all the laws will be same, all the ethics standards will be same. And the same thing will be applicable in telemedicine also. Along with this, you should follow telemedicine practice guidelines, which is 2020, which we are going to discuss now. So can I provide a telemedicine consultation to a patient residing in another state? For example, St. John's gets many patients from West Bengal or many other states. Can the St. John's doctor can provide telemedicine consultation for a patient who is in West Bengal? The telemedicine guideline is very clear. Doctor is entitled to provide telemedicine consultation to a patient from any part of the India. So now this guideline has settled this confusion. Can I provide a telemedicine for a other state? You can provide. So this guideline is very clear and it has settled this confusion once for all. What are the guiding principles of this telemedicine consultation? So the guiding principle can be roughly divided into two things. One is regarding the patient and the other one is the doctor. The patient has a right to discontinue telemedicine at any time. He may say, sir, I don't want to come on telemedicine. I would like to come and meet you in person. If he says that, that means he can discontinue. He has all the right to choose. At the same time, the doctor also has a right to say, you are not fit for telemedicine. You have to come for in person. That is one. And the professional judgment of the doctor will decide whether the person will receive telemedicine or not. At the same time, the doctor also can decide whether the patient can come for audio, video, or else just it may be text or a photograph. On that basis, the mode of telemedicine consultation also the doctor can decide. So to repeat, the patient has the choice to refuse. At the same time, the doctor also has a professional judgment or discretion to decide whether the patient will receive in person or telemedicine. And the mode of choice, audio, video versus text or a digital, that is also allowed. So can either of the party can be anonymous, telling that, sir, I don't want to come on video. I would like to be anonymous. Is it allowed? No. The telemedicine guidelines completely prohibits the anonymous telemedicine consultation. Both the parties need to identify each other. The RMP has to ask for the ID of the patient. ID may be government ID, it may be Aadhaar card, PAN card, any identification which the patient, which the doctor can identify, A. At the same time, there is an obligation casted on the doctor to recognize or identify himself by telling that I am so and so, this is my registration number, this is my, what we call it as specialization, I provide these services. That has to be clearly has to be done. In this process, whenever the doctor feels that the patient is not providing the ID, the telemedicine consultation can be stopped then and there only. First and the foremost is both have to identify each other. That's the very important point. So what are the different methods and mode of telemedicine consultation allowed here? Text, that is SMS, email, images, that is maybe CT scan or MRI images, audio, video, digital data. Please do understand they have kept audio also for one reason, because if you look at the American telemedicine guidelines, there it is very clear. If the doctor is spending around 5 minutes on audio call, it is chargeable and the insurance does give what we call it as the reimbursement for that. And so it is audio. And if by chance even the text it is sent, if the patient is sending a bulk of what we call it as document, it may be around 40 pages, the doctor has to go through the whole document. He spends something around 20 minutes. And the insurance in US, they do give what we call it as reimbursement for the time spent by the doctor. So all modes are approved: text, audio, video, and digital. So no media has been prohibited. Please do understand, this is a very essential thing. When the telemedicine guideline was drafted, and NIMAN's Dr. Professor B.N. Gangadhar, director, was party, and he was one of the member of the ethics committee. They were very clear that telemedicine should reach the rural population. It should not be only for the metropolitan cities. That is the reason they have not banned social media. You can use WhatsApp, you can use any social media where the patient is comfortable. They have not banned social media. Simple reason is the social media is widely used by many of our rural patients. And if the patient says that I am very comfortable in WhatsApp, you can use WhatsApp. So what we call it as video chat can be used with the patient, or else you can send the prescription on WhatsApp. So it's the basic agenda is to reach the rural population. They have not told that you have to use such a big hardware, you should have big software. No, they have said whichever the patient is able to use, the doctor, if he's able to adapt that, it's excellent. The telemedicine guideline, which has been drafted by India, is one of the best in the world, if you ask me. If you look at the American telemedicine guidelines, after the COVID-19, they have removed HIPAA compliance. The reason being is because of HIPAA compliance, the doctors were not able to use this telemedicine for the complete, what we call it as the benefit of the patient. Now, similarly in India, the telemedicine practice guideline do not prohibit any social media. The main reason is to reach the rural population. Who can initiate the telemedicine consultation? Patient to the doctor, caregiver to the doctor, doctor to doctor, that is basically doctor to the specialist, healthcare worker to the doctor. And it can be two types of consultation, first consultation and follow-up consultation. And again, I would like to emphasize, the doctor has the discretion to decide the mode of teleconsultation. It may be in person, it may be text, it may be audio, it may be video, or he may say that you have to come for in person. So all these method is allowed for the doctor to do it. How to initiate a telemedicine consultation? The patient will contact the doctor either by message, email, audio phone call, or a video call. Any of these things when the patient does it, it is an implied consent. That means the patient has given a consent, as it is equivalent to patient coming to your chamber. So it is an implied consent. Once he does that, the doctor has to make an identification of the patient by asking about the various government ID. Once the doctor is satisfied about the identification of the patient, he will quickly assess for the emergency situation. If the patient does require an emergency consultation, immediately he will give advice for the first aid and an appropriate referral will be done. If there is no emergency required, he will continue with the telemedicine consultation. Detailed assessment is done. Investigation may be asked, and during that process, if the doctor comes to know that no, again he requires emergency, immediately he will be referred to in-person consultation. There is no emergency, further he will continue the detailed assessment. During the detailed assessment or the evaluation, he may ask to talk to the other family members. He may ask for investigation. If the doctor feels that no, the patient requires physical examination, the doctor, we may ask him, go to the nearest PHC doctor or nearest doctor or maybe nearest nursing home to get physical examination done, get the investigation done, and come back. So once the investigation is done, after 2 or 3 days, again the telemedicine consultation resumes. But whatever the investigation is done, whatever the discussion occurs, that has to be documented and the record has to be kept. So this is how the process takes place. And when should doctor take explicit consent? We talked about implicit consent. Is there a place for explicit consent? And what is the format for explicit consent? The explicit consent has to be taken whenever the doctor is initiating the telemedicine consultation, healthcare worker is initiating the telemedicine consultation, or else the caregiver, the patient family member is initiating the telemedicine consultation. Then there should be an explicit consent. The explicit consent is the patient can be saying either by an email or a text or a video or an audio message sent to the doctor will be considered as an explicit consent. It need not be written, signed one. A patient coming on the video and telling that, sir, I want telemedicine consultation and my father will be representing me along with me. So that kind of information, if he is able to give, that is the explicit consent, and it has been made very easy. So any rural patient, if he is able to come over and he is able to talk either by audio or video, he can give explicit consent. So what to do if a patient has called me in an emergency situation in the middle of the night, or it may be he's calling you, suddenly my father is having a chest pain, or a patient has fallen down from the 3rd floor. What should we do? There is an emergency situation and the patient has contacted you. Please do understand, in emergency situation, it is the professional judgment of the doctor to decide to go ahead with the telemedicine or not. But however, at the same time, the practice guideline also says that the doctor must advise for in-person consultation during emergency care. That basically the reason is during emergency situation, if the patient is contacting you, you are staying far away, you may not be able to help the patient. You may not be able to administer the medicine. The patient may not be able to have access to those medicine. Keeping those in mind, for emergency situation, the telemedicine practice guideline is very clearly has said that you have to advise for in-person consultation or else send the patient to the nearest health establishment. That is how this telemedicine guideline has been written. But at the same time, you should not say that, oh, this is an emergency situation, I will not do. You have to provide advice for first aid. You have to say that ABCD has to be done. You can give a counseling and facilitate referral. You can tell them which part of the Bangalore or which part of the Tumkur, or you are in Bijapur, which is the nearest hospital. You go to that nearest hospital, the doctor will be available. If you know some doctor there, you can call them and tell them so and so patient is coming. So that facilitation of referral should be done. This is how the emergency situation has to be dealt. So please do remember, doctors, that in emergency situation, in-person consultation is the default, and you have to advise for first aid and counseling. What to do? The patient has contacted me for the first time. So, or you never know the patient, but he has contacted you. What should you do? And the first consult means the patient is contacting you for the first time, or else he is your old patient, but he has contacted you after 6 months. That means for the past 6 months, he has never contacted you. Or else he has contacted you around 2 months back for headache. Now he is calling you for fracture. That is a different health condition. In all these situations, it is called as first consultation. I will repeat. The patient is the first time he is contacting you. You never knew the patient. A. B. He is your old patient, but he has never contacted you in the past 6 months. C. He has contacted you earlier around 2 months back for headache. Now he is contacting you for the fracture. Though he is a past in 2 months he has seen you, he is contacting you for the different health condition. All these considered as a first consultation. Again, the process is similar. Patient will contact the doctor either by the text, audio or video. It is considered as an implied consent. Identification of the patient has to be done by the doctor. Ask for the ID card. You can ask him to send a photograph of the ID, or else if you are able to recognize the patient, well and good. If you are unable to recognize, you have to ask for the ID. Once the ID is done, quickly assess for the emergency. If there is no emergency, he will go ahead with the detailed assessment. During the detailed assessment, you have to arrive for a provisional diagnosis at least. Once the provisional diagnosis is done, he will do health education, counseling, and he will prescribe medication list O. If it is a video consultation, you are allowed to do list A. List O and list A. List O is over-the-counter medication. These are all those over-the-counter medication where you need not give prescription. It is over-the-counter medication. The patient can go directly to the medical shop and ask for the medicine, and over-the-counter medication will be given without prescription. Medication list A requires prescription. For that, video consultation is must for first consultation. Coming to the next point, that is for the first consultation. Now, if an old patient has contacted you, or else it is a follow-up consultation, what should I do? Follow-up consultation means patient is consulting the doctor, and in the past 6 months, he has met you for in-person consultation. That means in the past 6 months, he has met you in your chamber and you have done the consultation. Then it is called as follow-up consultation. However, it excludes two things. If the doctor does not remember him, you don't remember him in the past 3 months or 6 months he has met you, then also it is considered as first consultation. That means this telemedicine guideline is so flexible. If the doctor is unable to remember him, it is considered as first consultation. If you are able to remember him, then it will be follow-up, but it should be within 6 months. If the patient is consulting for a new set of symptoms, then also it is considered as first consultation. This is how the process goes. The patient is contacting the doctor again through text, either by SMS or email, audio or video. It is considered as implied consent. Identification of the patient has to be done. Once the identification, here not only you are asking for the PAN card or various other card, you can ask him, show me the previous consultation in the past 6 months. what are the prescription I have given. If you have a hospital number, ask him the hospital number. Ask him for the mobile number, what he had registered. All those things you have to ask. If you are able to identify, yes, you have seen him, you will continue with the telefollow. If you are unable to remember him, you will consider it as a first consultation. Once you know that he is a old patient, you will go with immediately assessing for emergency. If there is no emergency, you will continue with the detailed assessment and you will arrive for a provisional diagnosis or a diagnosis. You will do health education, you will do counseling, you will do refill of the medication what you have done with the in-person consultation, or else you will choose medication list B. I will come to this list A and list B shortly. And if there is a new complaint has come, you will go, it will be considered as a new consult. So the next question is, can a caregiver initiate a telemedicine consultation? For example, the patient is illiterate, or else the patient has a dementia, or else the patient is a person with mental illness, or is a disabled patient. Can a caregiver consult on behalf of the patient? Yes, of course. Medicine guidelines. Sorry for the technical glitch. Caregiver. I request, please, I think couple of people have kept the both laptop and mobile on. Please switch off the mobile phone. So that is the reason. Thank you for cooperation. The caregiver is a family member or any person authorized by the patient to represent him. I request the audience to mute their mic, and if they are logging in by two equipments, please switch off one. Otherwise, it will cause disturbance. Thank you for cooperation. So coming back to the presentation, a caregiver can contact the doctor for telemedicine consultation, and it has to be authorized by the patient. There are two different types here again. When the caregiver is contacting the doctor, patient is there. That is one situation. In the another situation, the caregiver is contacting you, but the patient is not there. So when the patient is there, you will talk to the patient along with the caregiver, consultation will continue. If the patient is not there, only caregiver has contacted. If the patient is a minor, less than 16, please do understand, unfortunately, why they have restricted for 16 years, I don't know. But here the minor is 16 years. The caregiver, that means parents, can contact the doctor directly in the absence of the patient, that is the minor less than 16 years. One, or else if the patient is incapacitated or like dementia, or else the patient is having severe mental illness, the caregiver can contact the doctor directly. During that time, the doctor has to verify the ID of the caregiver and also the ID of the patient whom they are representing. Along with that, there should be a authorization letter. Every contact, the authorization letter should be fresh. It should not be like 6 months back the authorization letter has been given. For every consultation, the authorization letter should be new. That authorization letter should be there, and a verifying document for the relationship between the patient and the caregiver who has consulted. So on this basis, the telemedicine consultation can be given in the absence of patient or with the presence of patient. The next question is, can a health caregiver can provide telemedicine consultation? Basically, if an ASHA worker or a nurse or maybe authorized person, can they do telemedicine consultation along with the patient? Of course, this telemedicine guidelines do give an opportunity for this kind of situation. A health worker means a nurse or allied health professional or a mid-level health practitioner, ANM, or else any other healthcare worker designated by the appropriate authority can be contacting the doctor directly. But however, this can be done either from the patient's home. Please do understand, patient's home, from PHC, it may be even from the wellness center, it may be from any place in the community, even from the mobile or else satellite clinic. The ANM or ASHA workers or any authorized person can directly contact the doctor. But however, before they do it, They have to check the ID of the patient. They should talk to the patient. Once this has been done, they will contact the doctor. The doctor, after again, he has to verify the ID. Along with that, he will go ahead with the, either it may be first consultation or follow-up consultation. Actually, this, what we call it as health worker initiating, has been a boon. If you ask me, a satellite telemedicine center can be started in a remote place. A nurse can initiate a telemedicine consultation because many a time the doctor may not be available. Even in certain places like Uttarakhand, there in the villages, pharmacist is sitting. He can be authorized to start a telemedicine consultation with a doctor who is there in maybe Rishikesh, Ames. It could be easily doable. So that's the beauty of it. Even if you look at the wellness center, from there, a ANM or else a nurse can initiate the telemedicine consultation. But there are the requisition is identify the patient, take the consent. Can a RMP initiate a telemedicine consultation with another RMP? That basically a PHC doctor asking for a specialist opinion. Is it allowed? Of course, RMP can contact another RMP or by a specialist. It is allowed. But however, the doctor who is consulting should take the consent of the patient. Once the consent is taken, then he can contact the specialist for providing the telemedicine care. However, the person who is contacting the specialist will be responsible for clinically implementing whatever the specialist advice. So the legal and clinical responsibility is on the doctor who is initiating the telemedicine consultation, not on the specialist. Can a RMP prescribe any medication on telemedicine consultation? Of course, the telemedicine guidelines gives what we call it as empowerment to the doctor to prescribe online. At the same time, it also says whatever professional and clinical accountability casted for in-person consultation, same ethics and law is applicable here also. At the same time, the doctor has to follow the clinical protocol, same SOPs, which is applicable in person, has to be applied here. For example, if a patient aged 48 or 50 comes to a doctor for erectile dysfunction, before starting a sildenafil citrate, you may require the patient to undergo ECG. Same thing has to be done even in telemedicine. You have to request him to get an ECG or even an opinion from cardiologist and come back. Once he provides ECG and the cardiologist opinion, Hugh will continue with the telemedicine consultation. At the same time, RMP, before he prescribes a medicine, he has to generate or gather adequate information, and at least he has to make a provisional diagnosis. Without diagnosis, provisional or a complete diagnosis, please don't prescribe medicine. That is considered as professional misconduct under the telemedicine guidelines. And you have to follow the prescribing guide list that I will discuss with you now. There are four important lists: list O, list A, list B, and list C. List O is the over-the-counter medication. For that, prescription is not required. List A. List A is, these are all relatively safe medicine with low abusive potential for refill and follow-up. Those are the list A. So basically list A means least abusive potential. List B. List B are those medicines which RMP can prescribe in a patient who is undergoing follow-up consultation, in addition to those which have been prescribed during in-person consultation. Basically, it is for chronic medical consultation, augmentation, add-on drug. For example, patient is a diabetic and he has seen you in the past 6 months in person. Now he has contacted you and the sugar level is not under control. If they are able to provide the sugar level by testing at home, you can add a medicine, or you can decrease a medicine, or you can change the medicine. That is allowed in list B. That means for telefollow-up. And list C is prohibited. Please don't write list C. I'll come to that list C. They are Schedule X and drugs listed under Narcotic Drugs and Psychotropic Substance Act of 1985. You should not prescribe these medicines. Coming to the matrix, least O. For least O, either a phone call, even SMS, WhatsApp, email, or even video call. All these allowed under least O. Least O is basically over-the-counter medicine. Least A. For least A, for first consultation, to provide least A medicine, it has to be video consultation. So without video consultation, you cannot prescribe least A. Without video consultation, you are allowed to prescribe only least O. In least A, you can prescribe if the patient is on follow-up. And there you can choose any mode of consultation. Coming to least B, you can choose any mode of consultation. It may be SMS, it may be email, it may be audio call, that is only phone call, or a video call. Least B is basically adding a medicine, refilling the medicine, and chronic medical condition, whichever low abusive potential, that medicine can be given in list B. Prohibited medicines, you cannot prescribe for telemedicine. They are all Schedule X. The drugs listed under Narcotics, Drugs and Psychotropic Substance Act of 1985. So prohibited list further. These are the medicines you should not prescribe. Basically methadone, buprenorphine, ketamine, tramadol, morphine, codeine, benzodiazepine. Please understand, benzodiazepine comes under the Narcotic Drugs and Psychotropic Substance Act 1985. They have been listed there. You cannot prescribe these drugs under telemedicine. It has to be in-person consultation. For Schedule X, amphetamine, methamphetamine, methylphenidate, phencyclidine, dexamphetamine, these are all secobarbital, all these medicines has to be not to be given online. It has to be in-person consultation. So before you prescribe, please do understand, before you give a prescription, you have to have a diagnosis or a provisional diagnosis. At the same time, you have to write the categories of A, B, C you should know. One more question which frequently asked is, can I prescribe injection? For example, insulin. Yes, telemedicine practice guideline clearly says you can prescribe insulin where patient is able to utilize those injection on his own. But however, you cannot prescribe other medicine where alternative oral medicines are available. For example, if you want to give vitamin injections, you cannot prescribe to the patient. It has to be prescribed directly to the nurse whom the patient is going, or else you have to send that prescription to an RMP. That means injectables are restricted. You cannot give injectables directly to the patient. The patient has to say, I am going to so-and-so doctor for an injection. You have to send that prescription to that doctor. So injectables are restricted except insulin. How to send the prescription? What is the format of prescription? The telemedicine guideline is very clear. Whatever ethics which is applicable under the regulation of 2002 under IMC, same thing is applicable here also. You can write the prescription, take the photo. Again, I'm repeating, take the photo on the mobile, send it. Or else you can scan it, send it. Or else you can use e-prescription. That can be sent. How to send it? It can be an email. It can be any messaging platform. It may be email. It can be WhatsApp. Wherever the patient is easily accessible, you can do it. So please, it has not prohibited any platform. Coming to this, suppose the doctor says that I would like to send it to a pharmacy nearby. I have a pharmacy, sir. I'll tell the patient to go and take the medicine from that pharmacy. Please do understand the telemedicine practice guidelines for that. You have to take explicit consent from the patient, and the patient has to say, I have allowed the doctor to send this prescription to that pharmacy. That has to be taken consent. So this is how the prescription should look. The prescription will have the hospital name along with the RMP's name, registration number, address, and also contact details, along with the date and time when the consultation was done. Name, address of the patient, age, gender, height and weight. LMP, it is applicable depending upon the gender. On the left hand side, chief complaints, relevant history, examination, lab findings, suggested investigation. Please, you have to make provisional diagnosis. Without that, it will be considered as misconduct. So without provisional diagnosis or diagnosis, don't prescribe. It will be very evident as a misconduct. So you have to have a provisional diagnosis. You have to write the generic name of the medicine and it has to be written in a capital letter. Along with this, you have to have a special instruction and below you will write that this prescription is generated through teleconsultation. RMP signature has to be written. So what constitute the misconduct under the telemedicine consultation? Whatever which is prescribed under ethics of 2002 regulation, the same will be applicable for in-person. Along with that, doctor forcing the patient to come only on telemedicine is a misconduct. Misusing the patient data without explicit consent will be considered as a misconduct, and also prescribing the prohibited medicine. Many mistakes occur because of the doctor writing benzodiazepine. Please don't prescribe benzodiazepine. If you prescribe that, it will be considered as misconduct. At the same time, RMP using social media to solicit patient, telling that you please come, I will provide you the care. Those kind of advertisement has been prohibited. Please don't do that. And also the penalties will be similar to whatever the regulation in 2002 says. Same penalties, basically removing the name of the doctor from the registry for 6 months, 3 months, 1 year, or the permanent removal of the name. What records to be kept in telemedicine consultation? This is the other commonest question which the doctor do ask. Log. Please do understand it is log. Audio log, video log. What do you mean by audio log and video log? The doctor Sanjay called me from this phone number at this time for a period of these many minutes. That is audio log. Video log. If the patient is calling you on WhatsApp, from what number, at what time, at what date, from what time to what time you are able to talk to him over the video. That is the video log. No need of complete audio recording. No need of complete video recording. It is the log which is required. Along with that, if the patient has sent an email, take a printout, keep it. If the patient has sent an SMS, take the phone of screenshots that can be kept. Along with that, patient has sent an investigation that can be there. Many a time, if you are not sure, you can send some kind of what we call it as an application to the patient. Please fill your problems. With the photograph of the human body, the patient can mark there where is the pain and he will send it back. And you can say that, okay, you have sent me the photograph where the pain is there. If the patient has sent an image of the wound, that can be a document. All these will form the record, medical record. And at the same time, whenever you transmit a prescription, a copy of the prescription has to be retained. For example, if you have written a prescription, the original prescription will be retained by you and the copy of the digital one will go to the patient. What about the confidentiality and the privacy? This is one of the biggest dilemma. Majority of our doctors have this. What happens, sir, if there is a data hacked? All those questions. RMP shall abide by the same Medical Council Regulation 2002 ethics. Same thing will be applicable here also. You have to follow the IT Act, Data Privacy Act, and also there is a DISHA. There is a bill pending in the Parliament which will be passed. You have to follow that. At the same time, whatever the laws and ethics which is applicable in person, same thing you have to follow. At the same time, RMP should ensure the reasonable degree of what we call it as security. Reasonable means you cannot have, it doesn't say that 100%. What do you mean by 100%? For example, I will give you, if you are carrying a dangerous chemical substance with you, the law says 100% you have to follow the law. Even if there is a mistake, you will be punished. Here it says reasonable. Reasonable means the doctor on his hand is having to have a security well formed, no need to problem. Somebody else hacks it on the patient side, his phone number or his phone is lost and the records have been taken away, doctor will not be held responsible. This is what the 3.7.1.3 of the telemedicine practice guideline is very clear. Registered medical practitioner will not be held responsible. Doctor will not be held responsible for breach of confidentiality if there is a reasonable evidence to believe that the patient's privacy and confidentiality has been compromised by technology breach. If somebody has hacked, or else somebody from the patient side has taken the data, or else somebody else, you are using your laptop and the laptop goes missing. You have lost the laptop. That means at that time, you will not be held responsible. But however, for the best practices, if you are able to enable remotely, you can wipe off the data. There are some applications available. If you are able to have that, like for example, iPhone says that if you lost the iPhone from remote places, you can wipe the complete data. If you are able to enable with those applications, that is well and good. Many laptops gives that option. Remotely, you can wipe off the data. So that if you are able to do it, it's excellent. Otherwise, for the technology breach, hack, and you are taken a reasonable degree care, doctor will not be held responsible. And it's very clearly written to enable telemedicine practice guidelines. Can we charge fee? Recently, there was a big, what we call it as a hangama. One of the politician made a video recording or audio recording of a doctor in Amritsar. It became viral. Later, this complaint had gone to the various officers at the higher level. The person who did this, politician, has apologized. Telemedicine practice guidelines has been resumed. As per the law, the doctor can charge appropriate fees, which is applicable as in-person consultation. Along with that, minimal charges for the technology can also be charged. Along with this, you have to give a fee, what we call it as invoice or a receipt. It has to be given to the patient. So that means the doctor is legally entitled for the, what we call it as the fees. But one more thing, what is happening, a problem during the COVID. Many of our doctors have given their number for free services. Unfortunately, at the same time, they have started telemedicine consultation also. Now, when the phone call is coming, they do not know whether it is from the helpline or else from the telemedicine what they are charging. So in such scenario, I request all the doctors to have a separate phone, mobile phone, for one for the helpline or else personal phone or else for telemedicine consultation. Also, don't mix your social media. If you have a personal social media, don't share with the patient. Have a professional social media. If you have a WhatsApp, keep it separate for a, what we call it as consultation. Don't mix it with personal social media. So keep it separate. You may have separate social media for the consultation. For personal, keep it separate. So don't mix both. And when you are doing consultation, come with the professional attire. If you are doing consultation from home, don't come with what we call it as sweatshirts, t-shirt. Don't do that. The same degree of seriousness what you do in-person consultation should be there in telemedicine. So that's very essential. That professionalism is required. What is the role and responsibility of the technology platform? There are many technology platforms are available. For example, I'm not endorsing anything. Like for example, maybe there is something called as Telearogya has come up. There is something called as Practo. There are many new platforms are coming. What is there? They are called as aggregators. They are also called as intermediaries. They are also called as platforms similar to Uber, similar to Ola. These, like, they provide care. That means there is a service provider, there is a patient. In between, these are the what we call it as software industries. What are their role and responsibilities? These aggregators, or what we call it as intermediaries, has to enroll only registered medical practitioner. At the same time, they have to show the qualification of the doctors, their specialization, their contact details. There should be a grievance mechanism available on their online. They should not use artificial intelligence. Artificial intelligence for diagnosis and issuing prescription, that is prohibited. At the same time, if these online platforms have to follow something called as IT Act of 2011 intermediaries guidelines that they have to follow. If they don't follow, the Ministry of Health and Family Welfare can blacklist and prohibit the doctors to use these, what we call it as the platforms. Coming to the last couple of sites, how to avoid medical legal issues online. First and the foremost, whenever you start the telemedicine guideline, have a separate phone number or a SIM card, have a separate social media for the professional reasons. At the same time, when you start every touch base with the patient, identify yourself, ask for the ID of the patient, document that. At the same time, whenever there is an emergency situation, refer the patient to the in-person consultation, do give first aid advice, facilitation of referral has to be done. Before you prescribe, at least have a provisional diagnosis. Without provisional diagnosis, don't prescribe medicine. Follow the prescribing list. Please do retain the investigations and prescriptions with you. Please do not share the patient data. For example, videos. Don't send the videos on WhatsApp. If you want to do that, take the consent of the patient. If you take the consent should be irrevocable. That means you have to explain the patient, if I am sending a photograph or a video of a patient and it becomes viral, I will not be able to withdraw if the patient withdraws the consent. And the patient should understand about this. That is called as irrevocable consent. That has to be clearly mentioned. Otherwise, please don't share patients' photographs, videos on WhatsApp with your professional, whatever WhatsApp group. Please don't do that. That will be considered as misconduct. At the same time, legal issues, whatever it is applicable in person, same law is applicable for telemedicine consultation also. From coming to the finally, what is the best part of this guidelines? Critiquing this, the best part of it is this guideline is very patient friendly. It is patient centric. It has not prohibited any social media. It is allowed to use any of this WhatsApp or any kind of messaging system. It is allowed that. It has given complete clinical freedom. The doctor can say you have to come for in-person consultation anytime at any stage of consultation. At the same time, patient can also say that I don't want telemedicine consultation. I want to come and meet you in person. Both the places it has given complete freedom. It's a fantabulous attempt, if you ask me, to reach the rural area. They have not made hardware and software heavy so that it is restricted only for Bangalore and metropolitan consultation. The idea is to reach to the rural area. When the telemedicine consultation first draft was written, we were part of it. When we went with all HIPAA compliance, do you know what was the one of the Niti Aayog person said? Please do understand, doctor, even if your father is sitting in a rural area, he should be able to use the telemedicine. That should be the idea, not coming with a bigger application or bigger hardware. So that is the beauty of this telemedicine guideline. Let me be very clear. This telemedicine guideline is going to be a paradigm shift, the way we are going to practice medicine, and it's going to be a game changer in the healthcare industry in a short time. What are the drawbacks? Of course, it has certain drawbacks. What happens if the patient records audio and video and he goes online and says that this doctor said like this? If there is a lady doctor sitting on the other side, he records that and puts on the, what we call it as social media, will he be punished? What is the privacy of the doctor? That is not been discussed. If the patient wants to complain, imagine a doctor sitting, Dr. Sanjay, who is sitting in Bangalore, gives a consultation for a patient who is in Orissa, Bhubaneswar. If some ethical issue occurs, whether the patient in Bhubaneswar will a complaint in Orissa or in Karnataka, that's not been clearly been delineated here. And if the data stored with the aggregator, or what we call it as intermediaries, who is the owner of this data? Tomorrow this data will be huge because we are 1.3 billion, and at this time 30 to 40 crore population have smartphone, and at least 28 crore are able to have what we call it as internet access. At the same time, many of these online platforms are rating the doctors by a patient. Patient will say this doctor is good, this doctor is very bad. And if there are 5 or 6 patients, can ruin a doctor's practice. If they go on rating very badly, they can abuse the doctor over online. This guideline do not talk about this, and I request the doctors not to use those platforms where the doctor is been rated by somebody else, and these rating can be bought by paying extra money in certain applications. So please don't do that. And if it is Clinical Establishment Act, like Karnataka Private Establishment Act is there, will it is applicable for telemedicine guidelines? Because it says that every doctor has to register here to provide services. Whether it is applicable, we don't know. That's very silent. This needs to be discussed, and it may take some time to come out. To conclude, whatever for your benefit, for how to start telemedicine practice, prescribing medicine, first consult, follow-up consult, medical legal issues, hardware, software required, free YouTube channel is available. That is, you can go through that YouTube channel, you can subscribe. All these videos are available there. You have to go to YouTube, see Suresh Badadmat. If you go there, all these videos are available. You can freely use it for your purpose and also for training your students. And to conclude, actually this COVID should have not come, but it has come. It is going to change our practice. The time is now. You are the person who should take the lead. And if you don't take the lead, you will be outdated like Nokia phone. You have to become a smartphone. So you have to take up telemedicine, foster that so that we can reach the rural area, so that the right to healthcare at home can be fostered. Thank you very much for all of you.
Thank you, Dr. Suresh, for a detailed talk on the new telemedicine guidelines. As and when we start collating the questions, I'd also want to say that the Telemedicine Society of India is conducting a small short course as a prelude to whatever the government has proposed. So you can go to the TSI website and take the course from the Telemedicine Society of India on these guidelines and how do you start a telemedicine practice of your own. One of the questions that we generally get asked is, should I record the video record or audio record these consults? Generally, most of the platforms ask this, the doctors ask this. So should we record?
Okay, see, this is again, if you are doing a audio record or a video record, you have to take explicit consent. Actually, telemedicine guideline is very clear. What you have to do is you have to record the logs, not complete audio and video record. If you are doing a video record, you require a huge space, because any 10 minutes or 30 minutes video recording will be around 500 MB, and sometimes it will go to GBs. So audio recording, video recording is not permitted. If you can do it, but you have to take a explicit consent from the patient.
One of the dicey situations here, the guidelines clearly say that we can do the teleconsults using an SMS, using audio, WhatsApp and everything. But and also it says at some point of time how the prescription should be. So that doesn't match. Like if I want to have a prescription which has the doctor's name, address, the registration number, his signature, and also mentioning this is done by teleconsults, how can that be transmitted via an SMS or an audio?
Dr. Sanjay, I think it's one interesting question, but please do understand, for over-the-counter medication, SMS text can be more than enough. Like suppose if you want to prescribe lozenges or some cough syrup which is available over the counter, by text message can be done. But for example, again, there is something called as when you can use social media kind of messaging, either it may be WhatsApp or it may be any other messaging platform like Telegram can be used only to the patient directly. There you can take the photograph of the what we call it as a prescription and can be sent. So in that way, it will be easily it can be transmitted. But however, for list A and list B, it has to be in the format which has been prescribed under telemedicine guideline. At least you have to have a provisional diagnosis before you prescribe. For list O, not required, a simple SMS can be done down.
So even if I'm doing an SMS, so can I write that patient, diagnosis there and then prescribe the list A?
I would rather stick to write it on the way the format has been given in the telemedicine guideline. Better to use your own what we call it as the prescription. Take the photograph and send it. SMS text to be avoided at that list A and list B. Nowadays, I don't think how many of we are using SMS. Most of the time, we are using WhatsApp or else other messaging platform that can be used. I think I would go with the taking the photograph and sending the prescription directly to the patient.
Okay. Does it come under the consumer court?
Of course, please understand telemedicine guidelines clearly comes under the consumer court if you are charging for it. It's very clear. You are liable under Consumer Act, which has been amended in 2019. And for the doctors, it's a great topic. We can have a lot of discussion. But at this point of time, it comes under Consumer Act if you are charging. If it is a free consultation you are giving because of the COVID-19, that does not come under the Consumer Court. But at this point of time, please do understand, it comes under Consumer Act.
Do we have the questions? So as we
one question is there.
Yeah, as we are gathering the questions, I think it's better. One of the questions that is said is, what about the commonly prescribed drugs like for acute exacerbation of respiratory conditions and antibiotics can be prescribed?
Sir, if it is in a first consultation and if it is an emergency situation, like if you want to give corticosteroid, avoid that. The reason being is, if it is an emergency situation, ask for in-person consultation. That should be very clear. So in emergency situation, the telemedicine guideline is very clear. In-person consultation to be done. Ask them to do, or you can give first aid advice, and you have to enable them for appropriate referral. So that's the way. But if it is a chronic condition like asthma, yes, you can prescribe. But for any emergency situation, avoid. That is my response.
There's another question which was asked in terms of the if platforms need to adhere to the IT Intermediaries Act, does WhatsApp and Facebook and Hangout adhere to it? So let us look at this way. This guidelines has been given by the NMC or the NCI state of government, which is for the Ministry of Health. There could be, we presume in the near future, there would be a Ministry of IT would come up with the guidelines in terms of the privacy and other things, and these two will have to marry each other to provide it. But as of now, until any guidelines comes in from the Ministry of IT, you can do these consultations on any platform without worrying about your privacy and or your what this is IT Intermediaries Act or anything of that sort. You can go ahead and do it. Use audio, video, any platform that is available, Facebook, Google Chat, Hangout, or there. Just after this came out, we have been seeing that many aggregators or the tech companies are coming up with these apps and everything, saying that why don't you use ours to consult other things. So please go ahead and use anything that you find it comfortable to use. Just ensure that the guidelines, while you are prescribing, you prescribe as per the format that has been advised in the guidelines, with your name, address, patient identification details, your registration number. The diagnosis is very important for you to write either the differential diagnosis or a full diagnosis. And whatever the prescription or the advice that you would want to give. So that's what I would say for this question. Anything else that we prescription.
I would like to say that WhatsApp is not a intermediary at this point of time. It's a video conferencing unit. Many a time, many doctors have been contacting me because I have been in charge of telemedicine center since past 8 years past 10 years in Nimans. Sir, can I use VC? What should be EHR and EMR? That is electronic health record and electronic medical record. See, if you are a single clinic, you need not have EHR EMR. You can use the video consultation. Whatever in-person consultation, if you are writing, you write there in your record, medical record. Physical record can be kept. Need not to have EHR and MR. So EHR, EMR, yes, it is required. If you are able to pay for it, well and good. Otherwise, a video conferencing and documenting on the what we call it as the patient came at this time or those prescription, that can become a medical record. So every time you require EHMR, no, you need not require. But if you are able to afford, well and good. That's the way it goes. And video conferencing is a means of contacting the patient. That's it.
I want to repeat once again, there's a question, should all registered medical practitioners undergo a training? Yes, there will be a formal announcement of a training module for you to be eligible to do teleconsultations. But right now, it is not formally announced. So please go ahead and do the teleconsultations. If you think you need some kind of a hand holding for your teleconsultations, there is a short training by the Telemedicine Society of India. You can go to the website and undergo the training, which is a 3-hour long training for that. But if you're finding it comfortable doing it on your own, please go ahead and start using the teleconsults, doing the teleconsults that you have. The one more question is about the obstetric consultations. How do we how do we do an obstetric consultations using tele?
Because this is a very general question. If they are able to give me one case vignette, I would be easy to discuss. For a general questions like how to do obstetrics and gynecology, for example, I will, since the question is very general, you can do antenatal care, antenatal checkup, or else antenatal advice. If there is a post-operative care can be done later, the patient has been operated, you have seen them. After 15 days or 1 week, you want to see them, you can see them. And many obstetric, OBG, gynecologists, many of our doctors are very busy actually, if you ask me. Sir, why should I do telemedicine? I'm already seeing 70 patients or 80 patients per day. Of course, 70 to 80 patients you are seeing. In that, at least 40 patients are traveling more than 100 kilometers to meet you. So at least for those patients, you can choose those patients for telemedicine consultation. So those patients need not travel for nearly 1 day and spend something around 2,000, 3,000 to meet you. So there you can choose even OBG for follow-up. And of course, in surgery and many places, it cannot replace. One, please do understand second point. This telemedicine will not replace lack of manpower. It's what it can do is the urban and rural divide, it will decrease. Whatever the lack of doctors are there, that will continue to exist. This is only what we call it as democratizing the available resources. That's it. For the lack of doctor, it cannot replace. Telemedicine cannot replace. Only thing is the patient can reach any of the doctor easily. That's the way it is.
Okay. So there will always be technical glitches. Even today, we can see the technical glitches here and kind of thing. So in between a teleconsults, there might be a technical glitch where we are unable to connect to the other person. So or the patient is talking something and then the line breaks off. So in those times, how do we address?
Yeah, whenever there is a technical glitch do occur, so need not worry, stop the teleconsultation, call them over the phone call and say that, sir, there is a technical glitch it may be on the patient side or it may be on the doctor side or not both of the side. The service provision agency, it may be if you are using BSNL or you are using Geo, or it may be server may be down, or if you are using video conferencing, the video conferencing server may be down. So you can tell them that is the problem and a new telemedicine consultation may be done. For example, you have done already 80% of the consultation. Last 10 minutes there is a problem, or last maybe 1 minute may be a problem. The telemedicine consultation can be considered as completed. Do a video, audio call, and then you prescribe the medicine, explain to them. So that can be doable. So depending upon the timing, the amount of time spent on telemedicine, on that basis you can say the consultation is complete, half the consultation is complete, or else a new consultation is required. So that's the way it is.
You have a question? Yeah, robot obstetric, this is all done. Slides, please. Yeah, slides. So one quick thing. So what are the investigations that I can prescribe over a teleconsult? Is there any restrictions on any of the, like a PET scan or an HIV, investigation? How do I? What are the restrictions?
See, any investigation you can prescribe the way it is required in person. So the same thing is required here. If for HIV, before do you prescribe HIV investigation, so pre-test counseling, test counseling, post-test counseling, if you are supposed to do is in person, same thing you have to do in telemedicine. Just because you are doing on telemedicine, you are waived off? No. Whatever clinical SOPs or clinical guideline is there, same thing has to be done. There is no restriction of providing or asking for investigation. But whatever SOPs you are following on in person, same thing to be followed here. Because just you are doing telemedicine based investigation for HIV, I will not do pre-test counseling and test counseling and post-test counseling. That is not acceptable, because in 2017, I think in June or July, June, July or somewhere on 18th, there is a rights of a persons with HIV and AIDS Act has been implemented. In that it is very clear you have to take a consent before you do HIV testing, which is required for in-person. That means it is required for telemedicine also. So those investigation which you can prescribe and the clinical standards, what is applicable in person, same thing applicable in telemedicine also.
Sure. So we have one last question. I think after that, Dr. Umashankar can start summarizing. What happens, like in a situation where a patient has come to me and I recognize him that it is an emergency, and I refer him to a hospital to physically go to a hospital. I have consulted him, recognized him as an emergency, referred him to the hospital, and on the way a mishap happens, there is a death or something like that happens on the way. Will I be liable at that time?
Okay. See, this can happen even in person also. You are sitting in a taluka place, patient comes to you in person, and you are referred him. On the way, again, same thing happens, he may die. Whatever the law applicable in person, same thing is applicable here in telemedicine. But however, in telemedicine, the beauty of it is there is a log available. That means the person called you at that time, you have given a prescription to go, you will write a referral and tell them you go to so and so person, or you go to a nearest hospital. That referral letter, if you have given and sent a photograph and sent, that means your responsibility stops there. So that means, see, one of the other beauty of telemedicine is there has been a couple of studies which have compared the in-person consultation and legal complications versus telemedicine and legal complications. The people who are practicing telemedicine, the legal complications are very less. And if you look at this telemedicine, though there are many issues are happening, it is practicing since 2 decades in India. Hardly there are no cases has been registered against any doctor. There are a couple of incidents which has occurred in Ratnagiri, where the doctor couple, basically gynecologist, went on giving consultation over the phone when they were not there in the headquarters. That is a different matter, because the High Court said they refused to give anticipatory bail, but the Supreme Court has given. The issue here is not telemedicine. The issue here was the doctors went on doing consultation when the patient was admitted with them for long duration, maybe around long duration. So the issue was not being there and admitting in their own hospital. Instead of that, they should have referred them to the nearest other hospital. So till now, in India, there is no telemedicine based cases against the doctor. But at the same time, there are n number of cases for in-person consultation. So legally speaking, the telemedicine has not only your document in writing, you have electronic recording. So in that way, it is safer. Violence is also minimal in telemedicine. So in that way, if you ask me, telemedicine is a best bet at this point of time. And also in NIMANS, we are using recently because of COVID-19 shutdown. Recently, we started calling all our patients who had come in the past 1 year. We had called, and in my own unit, we have done one small auditing where we contacted around 200 and odd patients who had recently come in the past 2 months or 3 months. When we called them and did the telemedicine consultation, 70% said, "Sir, we would like to have a telemedicine consultation. If the video is not available, audio is fine." Only 30% said that we would like to come to NIMANS for treatment. Otherwise, 70% said that please provide me telemedicine consultation. So it's if you ask me, already the society is requesting for telemedicine. The clients are requesting. It is the doctors, we are not picking up the telemedicine. Let me tell you, in another 5 to 10 years down the line, your children, my children, whoever the children, they are tech savvy. They are going to go online and look for the doctor in and around. Retailization of the doctors will happen. If you are not online, you may lose practice. Now it is fine. Over a period of time, the time has changed. You have to be available on telemedicine. The day may come in another 10 or 15 years down the line. The government may come up with the policy telling that first consultation has to be telemedicine. The doctor has to say you have to come in person. That day may come, it's not far away. Insurance will be provided. And also, if you look at this telemedicine, already there is a discussion going at Niti Aayog. Why not telemedicine consultation can be open for other neighboring countries so that the specialist can provide services for those countries. So that means already there is a discussion to provide services for other countries. So this is a game changer. Please do take it up. If you don't take it up over a period of time, you may be the loser. That's what I can tell you.
So I have a couple of more just coming in. So for sure, taking it from what Dr. Suresh said, there has been teleconsults earlier, also the Pan Africa and the Pan SARC consultations that was being done, but that was limited to only institutions per se. But today, with the technology in the forefront, I think teleconsultations can happen anywhere across the world. And I also see a time where most of the outpatient consultations would happen using tele, and only critical care, acute care, and procedures and all those for those things, patients will come to a hospital per se. Spain has taken it up already, where all first, as Dr. Suresh was saying, all the first time screening will happen using tele, and only after that a patient will come to the hospital. There's one question, legal question, in terms of we'll start maintaining the logs. Today, in our own consultations, in the OPD consultations, we don't have any registry. Probably in institutions like NIMANS or any of the medical colleges, there might be a registry of patients who come for an OP. But in a private practice, there are no OP registers. So having that in place, how long should I maintain these logs from the telemedicine if I'm going to maintain it? So there's an extra work for me that I need to maintain a log for these teleconsults. And how long should I maintain it? 1 year, 2 years, 10 years, 6 years?
Okay, Sanjay, this is an interesting question. Please do understand, the log doesn't mean that you should have a complete registry. So as per the telemedicine practice guideline, you have to keep a prescription. Whatever you prescribe, and you are taking the photograph and sending the digital copy, the original prescription is with you. That time you can write there, the patient contacted me with this phone number at this time, and this was the duration of consultation. That becomes a log, and you need not do any extra thing. That prescription itself is what we call it as a medical record, that you can keep it. The duration is as per the if you look at the Indian IMC ethics regulation 2002, it says 3 years for the private practitioners, that too for inpatient. But however, I would rather say if you are able to keep this, whatever the prescription you have sent, where you have written the symptoms, diagnosis, prescription, what phone number, and how they contacted you, duration, video log, audio log, if you are able to keep it up, why not? You can keep it for 2 or 3 years. 3 years is the general what currently for the inpatient, but the outpatient it is not there. Hope there has been a discussion this issue of what the NMC when the rules are made, there they may settle this issue for outpatient and inpatient. The duration may be told at this point of time. There is we don't know for the outpatient. Inpatient is very clear, 3 years. That is clearly written in the regulations 2002 Indian Medical Council
So
regulation.
as a recommendation, we can say that to maintain those logs for 3 years.
Yeah.
And probably we can also maintain those logs digitally also.
Yes.
Need not be physical papers all the way.
Right, true.
Because there is no clarity on it, we can take that. And one more question is the duration of a teleconsultation session. Is there any restrictions on the duration? Or if it is going on and on and on from the patient side, how do I disconnect it? How do I end a teleconsult?
Okay, so this is this is one of the other interesting question. So please to understand,
especially it might happen in your telepsychiatry, where it would be very long sessions that would go on. So how do you deal with those?
Yeah, when the telemedicine consultation you start, you have to clearly mention the duration. You have to say 10 minutes costs this much, and after 10 minutes it gets logged out. That should be the way. One A. B. Suppose if you are doing counseling, if you are doing counseling for various reasons, it may be in psychiatry, it may be even for counseling for diet, it may be counseling for physiotherapy, or it may be counseling for various other maybe surgery, pre-surgery or elective surgery. You are doing counseling. The counseling may go for 15-20 minutes. You'll be very clear. One consultation may be 10 minutes. You can decide about the cost and the duration also. You can fix it. On that basis, it will go. If the patient is going to pay for, you say that if it is 30 minutes, it will be 3 consultation. So depending upon that, you can charge. So invariably, if you look at many of these apps, they are kept as a 10 minutes as the duration of one consultation. So that is how it goes. But you have to prepare the patient before the tele-video consultation starts. The best way, if you ask me, if a patient is contacting me over the phone or it may be by a message, I'll immediately look at the number or the email. I will send him a pro forma to fill. And I will ask him to write what is his problems, his treatment if he has done investigation to put there, and send that pro forma again by either digital, by WhatsApp or email. I will go through that. When it is ready, I'll tell him, so you have written here, these are the problems. And you have to tell him, this is in that when you send the pro forma, you can put the guidelines also. Every 10 minutes is one consultation. Each consultation charges this much. And you can say what is the rights of the patient, what are the rights of the doctors, and you can also give the link for telemedicine practice guidelines. So that will reduce your what we call it as legal liability, and the patient is filling the pro forma and sending it to you, so that it itself becomes a documentation.
So I'll take one last question and then end it as one. So if we need to examine a patient, say that we need to visually examine a patient, not by palpation or percussion or anything. It is an inspection examination, and probably we might want the patient to undress over a teleconsult.
Okay.
So is that permitted? What are the kind of precautions that we need to take in that scenario? We want to ask the patient to undress.
This is a very tricky question. Seriously, I don't know the answer. Let me be very clear. I don't know the answer because if you are asking if patient to undress, and if the patient is a female patient and a male doctor, because we don't know whether the nurse should be this side or that side, we don't know. I don't know the answer. Seriously, I don't know the answer about this issue. I would, in such scenario, I don't know how to go about. It's a very funny situation. Seriously, I don't know the answer.
Anything, Umar? You have any comments on this?
No, from my experience of working in teleconsultation, we had certain female patients who had come, especially in rural areas. So there we had to, especially for gynecological conditions. So we had made all the privacy arrangements for the patient in that particular rural center, and even where the doctor is there, it was only the doctor who was present and a nurse who was present. So we try to take care of those kind of precautions. But how correct it is, we are not sure. But
So
in rural area, what else can be done?
So probably what we could, I would say, is have an attendant. If it's a female patient, have a female attendant at the patient side also, and the doctor side also.
See, if it is between the doctor and healthcare worker, issue is sorted out. But if you're directly, the patient is contacting you and then you require to do the undressing, I would rather slightly be what we call it as cautious, because the telemedicine practice guideline has come now. We have to trend very carefully.
Yeah.
And anyhow, there are now what we call it as recently 2 days back, there is an online platform launched by a female entrepreneur, and it is for female patients. So if that is a secured where a female doctor is contacting a female doctor, female patient, those kind of maybe the one
It could
possibility. It may evolve over a period of time, because this is a very fertile area. Innovations of telemedicine can be done. It can be, one is doctor to patient, doctor to healthcare giver who is a nurse, and the patient can be there, doctor to another doctor who is sitting on the other end, and can be doable. But doctor to patient and the patient we have to address, I seriously, I don't know the answer.
Sure. So I was just mentioning, there is a last question. The RMP to RMP, it is a standard. One doctor can consult another doctor for a second opinion. That is completely allowed. And healthcare worker, it could be an ASHA worker, it could be a nurse, it could be any of the healthcare workers can consult another doctor with the patient in front of it. That is also allowed with the consent, of course. I don't see any challenges in that. So I think we have run through all the questions, and we're also about
There
time.
was, I have just received one question, especially for dispensing of medicines.
Okay.
They are asking whether I can courier the medicine to the patient.
Okay, so this at this point of time during COVID, why not, sir? Because medicines are not available. Actually, there are many people have started couriering the medicine, and many a time the medicines are carried from one place to another place. I think it should be possible, but again, I don't know whether if it is a prohibited medicines. Please don't do that. And if you are able to send them, it should be A, B, C. That's O, A, B, C. That's the basically you should know the prescription, and sending the medicine should not be a problem according to me. But however, there are certain medicines in certain states are prohibited. You should know that part. For example, I can give you I did not mention about this. There has been amendment under the MCI for the list of medicines for the NDPS drugs, clonazepam, clobazam, and phenobarbital has been allowed for list A and list B. All these three drugs, clonazepam, clobazam, and also the uh, phenobarbital are allowed, and those medicines can be prescribed. And the another one is methylphenidate has been approved. It is in the process of getting notified. In another maybe few days it will be available only as a list B by a psychiatrist or a pediatrician. So those medicines will be made available, though they are under NDPS. So the MCI is changing it. But I don't think during this COVID situation where the medicines are not available, you can courier those medicines should not be a problem. You are helping the patient, and definitely it will be appreciated by anybody for doing such kind of activities, sir. But don't send list C. You will be caught for trafficking the medicine.
Sure. So before I hand over to Dr. Umashankar, there are various devices that can be used in teleconsultations. We have ophthalmic devices that is there in the teleconsults. We have otoscopes that has been there. We have stethoscopes that has been there. So I'm just answering one of the questions. So you can look at any of these devices that you would want to use to your satisfaction and use them during the teleconsultations. It is not banned per se as per teleconsultation guidelines. Whatever you used to do in physical consultations, you can use them if those devices have the tele capability. We have I have seen myself, there has been ultrasound imaging that has been happening via tele. The ICUs are managed via tele. There's a huge number of ophthalmology centers, vision centers from Arvind and various centers that has been there. So that has been managed by tele. So I think there are various devices capable of teleconsulting available. You can use them. So we are 5 minutes there. Dr. Uma, can you please summarize and conclude this session?
Yeah. Dear friends, I think we have had a very detailed insight into telemedicine guidelines from our expert, Dr. Suresh and Dr. Sanjay. It's left for us now, how do we proceed further? Now, I think we all must rise to the occasion and not get paralyzed by prevailing anxiety and agonized because of this, which we are going through right now. I'm not talking just right now, it may be even during the future with the spread of COVID, what is happening. So we know that every country or every state has systemic problems in their health systems. There is a lot of limited access to care for some segment of population. Maybe most of the rural population do not get care. And there is even, we also see there is uneven quality of care which is providing. And nowadays there is a lot of escalating the cost and there are a lot of issues which the patients don't get proper quality care. I think one solution I think we could see very clearly is telemedicine is a solution which can be provided even at the rural area. In the health system, we can have a sustained health care throughout let's say throughout the year, whatever may be the condition, whether you have any disasters, you have any emergencies, or any kind of pandemic situations like this. I think all the medical professionals and the government and the policy makers should take a note of how telemedicine can be used and put use to the best possible. We need to extract as best as possible from this a wonderful tool called telemedicine. In long run, this will provide a lot of healthcare access to the patients. Yeah? And what happens is, even in the hospitals, there is a lot of load of patients which are coming to the hospitals, either the government hospital or to the private hospitals. So telemedicine can be one kind of a tool where you can triage the patients. We can encourage few patients who need to be access care in person, and those patients who need not be access to be examined or to do some kind of a procedure, they can use telemedicine. Okay, so by doing this, we may maximize the efficiency of the health systems. Now, with rapidly changing in technology, there is a lot of scientific development happening, advances in robotics, like we are doing a lot of advancement in technology in robotics. There are very good sensors coming up, artificial intelligence, data management, and data analytics. With all these, we can provide a solid foundation for delivering healthcare in the right healthcare to the right people, to the right patient at the right time. So I think by doing this, we can minimize the inappropriate treatment and provide the best care to the population.
One more thing I request you all is we have something called as Telemedicine Society of India. There is a Karnataka branch. Please do become a member. So this by becoming a member, you will be knowing which are the latest gadget available, and also becoming a TSI member also will give you a privilege to know what is going to be the next technology, what are the artificial intelligence being used, what are the various apps, applications can be used for telemedicine. Although the telemedicine guidelines do not talk about any application. If you are in the TSI platform, this TSI platform is not only for doctors, for engineers, for the entrepreneurs, and also even for other doctors from other fraternity like Ayurveda, Ayush, doctors are also allowed, so that it's a huge platform, and the many members are from ISRO. They are there for seeing how we can take the telemedicine for the larger picture. So this is called as Telemedicine Society of India, Karnataka branch. We are here. So please do become a member of Telemedicine Society of India. Thank you very much for your patience listening. Thank you.
Thank you.
Stay safe.
stay home bed आएगा.